A 76-year-old female presented with a sudden decrease in vision. On examination, a shallow subretinal hemorrhage was noted, extending into the foveal region. Best corrected visual acuity, BCVA, was recorded at 6/36. Given the limited extent of hemorrhage and absence of significant elevation or associated pathology, a conservative approach was adopted, and the patient was advised close observation. 1 week later, the patient returned with further deterioration in vision. Visual acuity had declined to counting fingers at 1 meter. Fundus examination revealed an increase in the extent of subretinal hemorrhage, now more densely involving the foveal region. In view of the progressive visual loss and expanding hemorrhage, surgical intervention was advised. The patient was scheduled for pars plana vitrectomy with subretinal injection of tissue plasminogen activator, TPA, to facilitate clot displacement and potential visual recovery. A standard 3-port pars plana vitrectomy was performed. Following core vitrectomy, the internal limiting membrane, ILM, was carefully peeled. Subretinal air was injected via the inferotemporal arcade. The inferotemporal site was deliberately selected to minimize the risk of inadvertent macular blowout and to ensure that the injected bubble migrates inferiorly. Following subretinal air injection, tissue plasminogen activator, TPA, was carefully administered into the subretinal space. A localized bleb was successfully created, facilitating optimal diffusion of the agent across the hemorrhagic plane. A partial fluid-air exchange was performed, replacing approximately 50% of the intraocular fluid. Subsequently, 20% sulfur hexafluoride, SF, gas was instilled as a tamponade agent to aid in subretinal clot displacement and retinal stabilization. The patient was advised to maintain a propped-up position for 3 days postoperatively. 6 days following surgery, the patient demonstrated encouraging clinical improvement. Submacular hemorrhage had visibly regressed, with notable clearing in the foveal region. Best corrected visual acuity improved to 6/24, reflecting early functional recovery.